And with so many positive cases, should schools bring back masking, or should they ride out the season hoping to potentially build up small children's immune systems? Continuing the conversation with us now, Dr. Monica Gandhi, thank you so much for your time. Thanks for being here.
Thank you.
And we are seeing those reports of hospitals becoming overwhelmed with RSV cases right now. Can you help put it in perspective for us? Could we be seeing similar measures as we saw during the pandemic, things like emergency field hospital tents?
Hopefully not. Actually, what we saw in Canada and the UK both is that this absolutely happened, probably because we have less immunity in our population to other infections, but it peaked and it came down. I always look to the UK as kind of 4 weeks ahead of us. And so hopefully we're going to see the peak very soon and have it come down as people get kind of natural immunity and they get immune from it as we spread. In terms of bringing back all these precautions, it's really going to depend. I think part of the reason that this happened is that mothers weren't exposed with their neonates. They weren't exposed to a lot of colds or RSV the last couple of years. So there's less immunity going around. Young children weren't exposed, so it's more severe now. It's called immunity debt. It's been documented in Lancet Infectious Disease, Proceedings of National Academy of Science, and we may have to go through this. Otherwise, we're going to keep on pushing it out. That's what's happening in China.
I hear you. So bottom line, do you think schools should consider masking again?
So I don't actually think schools should consider masking. I think that ventilation is probably the best non-pharmaceutical intervention for all respiratory pathogens. We've really seen that through this pandemic, especially young children. It's really hard for them to wear a mask properly. It's wet, it's slipping up and down. It just has not been effective, not used in the rest of the planet for really young children. Actually, the WHO never recommended masks for those under 5, maybe partially for these reasons. So I wouldn't bring back masks, but I would use ventilation, hand washing, hygiene into your elbow, and stay home when sick.
Why is the outbreak impacting certain parts of the country more than others?
It could be that we have more immunity debt in some parts of the country than others. It could be that COVID cases are coming down in other parts of the country where viral interference is occurring. What does that mean? Viral interference means as our immunity rises to COVID is not as much of a problem. I'm working in the hospital right now. We have very little severe disease from COVID, with cases out there, but not severe disease. And as COVID comes down, immunity rises, the other viruses come in, unfortunately, to fill that vacuum. So our cases with COVID are rising and falling to different degrees. And that's when RSV comes in. That's when influenza comes in, when COVID comes down. It's called viral interference. So I think we're seeing that at different rates across the country.
All right, Dr. Monica Gandhi, always appreciate it. Thank you.
Thank you. Get your flu shot. Thank you.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.